As we go further now, the next topic is neck triangles. Let us discuss some details. Actually, we've got a question. This question is asking what is not in the anterior triangle. It is asking for exception. Now, if you are asking for exception, what is not there in the anterior triangle? I think this is the answer. Which one? I think this one. Why? Because it is not on the anterior side, it is on the posterior side. How can you tell it is on the posterior side? And what are the triangles on the anterior side? Digastric and muscular, anterior muscular and submental. So these are anterior, yes. And who is posterior? Posterior triangle has two parts. And what are the two parts? There is an occipital triangle and there is subclavian triangle. Okay, so this one, yes. So posterior triangle has two parts. One is the occipital triangle and the other subclavian. Yes, that's why you took this answer. Yeah, that's why. Because it is not anterior, it is posterior. Okay, if you say so, can we see the names now? The anterior posterior triangle? Yes. Actually, posteriorly we have two. And anteriorly we have four. What are the four? Then discuss. See, the boundary line is this muscle. What is that? Sternocleidomastoid. Why it is called so? Because attaching to sternum bone, clavicle bone and the mastoid bone. So it is taking origin from sternum bone, clavicle bone and attaching to mastoid bone. That is why the name is sternoclavicle mastoid, sternocleidomastoid muscle, and is the boundary line between. It is a boundary line between the two triangles. What is the two triangles? There is the anterior triangles and the posterior triangles. So this is the boundary line of posterior triangle. It is a triangle. It will have three sides. What are the three sides? It is sternomastoid muscle anteriorly, and what is posteriorly? It is a trapezius. If you say trapezius is posteriorly, then what is the base? Base is a bone which is the clavicle bone. So middle of the clavicle, middle 1/3 of clavicle almost. So almost middle 1/3 of clavicle is the base. Yes. Right. Okay. What is this muscle coming from scapula bone? This muscle coming from scapula bone is the omohyoid muscle. It has one inferior belly, which is also called posterior belly, and it has superior belly, which is called anterior belly. So superior belly is also called anterior belly. Yes. And posterior belly is also called inferior belly. What is inferior belly doing? Inferior belly is actually dividing the posterior triangle into two parts. If you say inferior belly is dividing posterior triangle into two parts, what are the two parts of posterior triangle? We have known. There will be one larger occipital triangle and a smaller subclavian triangle. That was our question. So this was the question, subclavian triangle on the posterior side, not the anterior. Yes. See, this is the occipital triangle near the occipital bone. So this is occipital triangle near the occipital bone. Okay, right. What is the name of the other? See, can you find inferior belly of the omohyoid is one boundary for the occipital triangle, and inferior belly of omohyoid is also the boundary for subclavian triangle. So inferior belly of omohyoid is also boundary for subclavian triangle. Yes. And what is there in the subclavian triangle? There. You can do some blocks. What blocks? You can block the subclavian artery and brachial plexus also. So we'll block the brachial plexus here. Yes. Why? Because multiple fracture in the upper limb. So there are multiple fracture in the upper limb and you want to kill the pain, and you will do brachial plexus block where? Into the posterior triangle of neck. Which part of the posterior triangle of neck? The subclavian triangle. And what else did you block there? Third part of subclavian artery. So you can block the third part of subclavian artery here. Yes. Can I see the magnified view? Yeah, magnified view will come, but here let us discuss the names of the anterior triangles first. Overview of the triangles first. So these are the anterior triangles. What are the names? Names will be actually, this is carotid triangle bounded by superior belly omohyoid. If you say this is carotid triangle bounded by superior belly omohyoid, why it is called carotid triangle? Because that is where we see right in the center common carotid artery bifurcating into two branches. So common carotid artery bifurcating into two branches right at the center of the triangle, carotid triangle. Yes, common carotid artery bifurcation into external internal carotid artery. All the three will be content here. And why would you say this is digastric triangle? It is called digastric triangle because it is bounded by anterior belly and posterior belly of digastric. And what is the base? Base is the bone, mandible bone. Base is the bone, mandible bone. So mandible bone is the base, anterior posterior belly of digastric. So digastric triangle, fine. What is this triangle? It is actually anterior muscular triangle where you have strap muscles. What is strap muscles? Strap muscles, they are, ribbon-like muscles, anterior neck muscle. So anterior neck muscle, strap muscle, when I separate them, what will I find? The thyroid gland. So are you telling thyroid gland is in the anterior muscular triangle? Yes, covered by strap muscles. So this is anterior muscular triangle where we have thyroid gland and covered by some strap muscle. Can you name some strap muscle, ribbon-like muscle? Yes, one is sternohyoid. Sternohyoid. So sternohyoid muscle is a strap muscle, ribbon-like muscle which I have to separate in the anterior muscular triangle to see the thyroid gland. Yes, let us see the diagrams for that. But there is one submental triangle also. Now remember, all these triangles are one on right side, one on left side, but submental triangle is only one in the midline under the mentum of mandible. So under the mentum mandible you have a triangle which is only one in the midline. Yes, otherwise whether you are talking about occipital or subclavian or carotid or the muscular or the digastric, whichever triangle you are talking about, they are one on the right side, one on the left side, but submental triangle is only one in the midline under the mentum of the mandible. Okay, then what are the boundaries? Boundaries, we'll see the boundaries, but of course it will have boundary of anterior belly digastric on both sides. If you say anterior belly of digastric is on both sides, then I think base is the hyoid bone. Yes, correct. Base is the hyoid bone. Anterior belly of digastric on either side and base is the hyoid bone. That is submental triangle under the mentum of the mandible. That is what where you have submental lymph node. Yes, submental lymph node draining the tip of the tongue. Tip of the tongue drain into submental lymph node in the submental triangle. And where the submental lymph node will drain? Submental lymph node can drain into submandibular or they can drain directly into the lower deep cervical. So tip of the tongue drain to submental will drain to submandibular? Yes. Or submental can drain directly into the lower deep cervical? Yes. Okay. Submental lymph nodes. Now we are going to draw this diagram ourselves. Which diagram? The triangle of neck. But before you start drawing that diagram, look at this lady. Long neck. No sign of beauty. If you have a long neck, it is beautiful neck. Males don't have, usually males will not have this kind of neck until you have derived it from your mother. If your mother was having long neck, usually the son can have, because son gets feature from mother and daughters get feature from father. It happens like that. Anyway, it is a long neck here and it is good for us. Why? Because things will be more clearly seen, What do you want to see? Actually, we want to look at the base of the mandible. Base of the mandible here? Yes. Okay, base of the mandible. Then what is below that? Below that is the hyoid bone in the midline. So this is the hyoid bone in the midline. Yes. And what else you want to see? The sternum bone in the midline. Sternum bone in the midline. I think this sternum is articulating with clavicle here on either side. Yes, clavicle there on the either side. And also you will have the scapula bone. So scapula bone, clavicle bone, sternum bone, yes. And their mandible bone and the mastoid bone, yes. Mandible bone and the mastoid bone. There you have mastoid bone. So there you have mastoid bone, yes. And there is the mandible bone, yes. Why do you want to know all that? Because I want to discuss about this boundary line muscle. Who is the boundary line muscle? You don't know? Sternomastoid. Why it is called sternomastoid? Because attached to sternum and clavicle. Attaching to sternum and clavicle. And what is the insertion? Insertion is mastoid process. Insertion is mastoid process. So sternocleidomastoid, yes, is the boundary line between the posterior triangle. So this is the posterior triangle. Yes, that is the posterior triangle. It is bounded by what? Bounded by the muscle on the posterior trapezius and anterior. Anterior, you have the sternomastoid. So this is the anterior sternomastoid muscle, yes, and that is the posterior trapezius muscle, yes, and then this is the clavicle bone below, yes, and that is the posterior triangle, yes, that is the posterior triangle. And it has two parts. Yes, it has two parts. The smaller one is the subclavian triangle, which is also called as omoclavicular triangle. So omoclavicular triangle is the smaller subclavian triangle in the posterior triangle. Yes. Okay. What about the anterior side? Anterior side, there are many. You can see this is the digastric triangle between the two bellies of digastric. And what is between the two anterior bellies? Between the two anterior bellies and the base is the hyoid bone. Between the two anterior bellies and the base is the hyoid bone is a submental triangle. One in the midline. One in the midline. Then I think this is the carotid triangle. Yes, carotid triangle, because it is bounded by sternomastoid muscle, and then it is the posterior belly of digastric, and it is the superior belly of omohyoid. Which belly? Superior belly. So superior belly of omohyoid and the posterior belly of digastric and the sternomastoid. I want to draw this. If you want to draw this, then let's do it. You have to draw the sternomastoid as the boundary line, and this is the diagram which we are going to draw. This is the diagram we are going to draw. What is this? These are the various triangles looking from the front view. So looking from the front view, you want to discuss some triangles now. Okay, let us do it. As you are drawing this diagram, we'll use this diagram. You mean to say we'll draw it on this diagram? Yes. Okay. Can we magnify it further? Yes, you can magnify, but just have idea. This is the base of the mandible. Yeah, okay. Then there will be some mastoid process, right? And then there will be the hyoid bone, and then there will be some sternum bone, and then there will be clavicle bone, and then there will be scapular bone. That is what you have to understand. Let's magnify. So you want to magnify this diagram? Yes, we want to magnify, and then we will draw the diagram. Okay, then draw it. As you see, this is the diagram we are drawing. And what are the boundaries? First you draw the midline of the body. If that is the midline of the body, then what are the bones related? The bones related are, there's a midline bone, which is the mandible bone. If this is the midline bone, the mandible bone, okay, fine. What is the other bone? It is the mastoid process. Mastoid process of the temporal bone. Yes, mastoid process of the temporal bone. And then you will have some occipital bone also. Occipital bone behind the head. Yes, occipital bone behind the head. Okay, so you're telling that this is the mandible bone in the midline, then this is mastoid process of temporal bone, and this occipital bone posteriorly. Yes, it is. Then what else do you see? This is the hyoid bone. That is the hyoid bone. Yes, that is the hyoid bone below the mandible bone in the midline. And what is this? This is the midline bone, sternum bone. If that is the midline bone, sternum bone, then I think this will be the clavicle bone. Yes, that will be the clavicle bone on each side. If you say that is the clavicle bone on each side, then this must be the scapular bone on each side. Yes, that is the scapular bone on each side. Now, once you have shown the bones like sternum bone and the clavicle bone and the scapular bone, then you are going to talk about this boundary line muscle, which is called sternomastoid. Sternocleido origin. Mastoid is insertion. That is the muscle? Yes, sternocleidomastoid. Sternocleidomastoid. So sternum is the origin, clavicle is the origin, and that is the insertion, sternocleidomastoid. Yes, sternocleidomastoid. Then it is dividing the neck into two parts, namely posterior triangle and anterior triangle. So what is the posterior triangle boundary? If you're asking me posterior triangle boundaries, I'll tell you. It is sternomastoid muscle. Yeah, that is understood. What is the other muscle? Other muscle came from occipital bone towards scapula and clavicle bone. So there is some muscle which is coming from occipital bone towards the scapula and clavicle bone. Yes. What is that muscle? Trapezius, the muscle of the upper back. So this is the trapezius, the muscle of the upper back. Yes. Trapezius, the muscle of upper back here also. Yes, of course. So you're telling this is the trapezius muscle, which is muscle of the upper back. What is the attachment? Attachment is occipital bone and the scapular bone and clavicle bone. Okay, fine. What is it doing? What it is doing, you wanted the boundaries of the posterior triangle, you got it. Boundaries of posterior triangle. I think sternomastoid anteriorly, yes. Trapezius posteriorly, yes. And then the middle one-third of clavicle inferiorly, yes. So this is the posterior triangle boundaries, right? Now, once you have told the I think posterior triangle has 2 parts. Yes, 2 parts. Tell me which muscle is doing that, dividing the posterior triangle 2 parts. I remember there was a muscle from scapula. Yes. Coming to hyoid bone. Yes. I think it is something like this. Correct. It is actually the inferior belly of omohyoid and superior belly of omohyoid. On the other side, no problem, you can show. This is from the scapular bone and coming to the hyoid bone. So it is attaching here. Okay, so you are telling this is inferior belly of omohyoid and that is the superior belly of omohyoid. If this is the inferior belly of omohyoid, that is superior belly of omohyoid, fine. Where is the triangle, that subclavian triangle? If you are talking about subclavian triangle, must be here. And if you say this is the subclavian triangle, what are the boundaries? Boundaries, inferior belly of omohyoid. If you say boundaries, inferior belly of omohyoid, what are the other boundaries? Other boundaries must be the clavicle bone and the sternomastoid muscle. So sternomastoid muscle, inferior belly of omohyoid and clavicle bone on the other side also. Of course, this is sternomastoid, this is omohyoid, inferior belly, and that is clavicle bone. This is, so you mean to say this is the subclavian triangle and that will be the, yes, that will be the occipital triangle. Yes, that is the occipital triangle. That is the occipital triangle. So this is the occipital triangle now. Yes, on the other side, yeah, you can show on the other side also. If you remember, occipital triangle should have the same boundary, which is inferior belly of omohyoid. So inferior belly of omohyoid is the boundary for the occipital triangle and it is also the boundary for the subclavian triangle. Yes. Subclavian triangle or the occipital triangle, both of them belong to the posterior triangle. Actually, posterior triangle is divided into 2 parts now. And what about the anterior triangles? Anteriorly, if you want to see it, then you have to talk about one muscle. Which muscle? That is here, coming from the mandible bone to the hyoid bone and from the hyoid bone to the mastoid bone. So are you talking about the anterior belly of digastric and the posterior belly of digastric? Yes. You are telling that this is anterior belly of digastric attaching to the hyoid bone and to the mastoid process there. Yes, mastoid process there. So, anterior belly of digastric is attaching to the hyoid bone. Yes. Posterior belly is also attaching to hyoid bone. Yes, hyoid bone, but then to the mastoid process. And this is the triangle. Which one? The digastric triangle. Who is the base? Mandible is the base. If mandible bone is the base, then what is the triangle called? Digastric triangle, because it is bounded by the 2 digastric muscle. Which 2 digastric? Anterior belly digastric, posterior belly digastric. This is the digastric triangle with the base mandible. Can I see the digastric triangle on the other side? Of course. This is the digastric triangle. Base is the mandible bone and then bounded by anterior belly, posterior belly, digastric muscle there. And this is the midline triangle. What is the midline triangle? This one. Who is the base? Base is the hyoid bone. If you say base is the hyoid bone, if base is the hyoid bone, then I think the anterior belly are the side. Yes, bounded by the 2 anterior bellies is the submental triangle under the mentum of mandible. This is the mentum of mandible. If that is the mentum of the mandible and this is the submental triangle, I think it is only one in the midline. Yes, it is only one in the midline and it has anterior belly digastric, and then it is the hyoid bone here. One triangle is now to be seen where you have the thyroid gland present. Where is the thyroid gland present? Thyroid gland is present here. This is the isthmus of thyroid in the midline. If you say this is the isthmus of thyroid in the midline, this is the thyroid gland. Where is thyroid gland present? Anterior muscular triangle. If thyroid gland is present in the anterior muscular triangle, one on each side, yeah, one half of thyroid gland on the right muscular triangle, one half of the thyroid on the left muscular triangle. There are two of them. So there are two anterior muscular triangles and both of them have the one lobe of the thyroid gland, yes, connected by isthmus in the midline. What is thyroid gland covered by? I cannot see thyroid gland until I separate them. Some muscles are there: strap muscle, ribbon muscle, anterior neck muscle. Can you name some of them? Yes, I'll name one of them. Sternum to the hyoid, sternohyoid muscle. Sternum to the hyoid, sternohyoid. So this is the sternum to the hyoid, sternohyoid muscle. Yes. Are you trying to say sternohyoid muscle is a strap muscle, ribbon-like muscle, which is in the anterior muscular triangle covering the thyroid gland? Yes, it is. Sternohyoid muscle, which is in the anterior muscular triangle. To separate that, you can see the thyroid gland in the anterior muscular triangle. Then there is one more triangle left. Which one? Where you had the common carotid artery bifurcation into external internal carotid artery. So this is common carotid artery bifurcating into external internal carotid artery right in the middle of the triangle. Yes. And that is the carotid triangle. Yes, that is the carotid triangle. So if you're telling that this is the carotid triangle, fine. That is where you have common carotid artery bifurcating into two branches. Yes. What are the boundaries? Boundaries will be sternomastoid and superior belly of the omohyoid and posterior belly of the digastric. So this does not appear to be a triangle. No, it is a triangle. This is sternomastoid and the superior belly of omohyoid and posterior belly of digastric. So you're telling this is the sternomastoid muscle, yes, and the superior belly of omohyoid, yes, and then it is the posterior belly of digastric, yes. What is inside the digastric triangle? You know already. Common carotid artery bifurcating into two branches. So these are the triangles which you wanted to know. We have the orientation now, and once you have the orientation there, see the details again. You mean to say deeper details? Yes, deeper details. See, this is the angle of the mandible. Yeah, I can see that. This is the hyoid bone. Yeah, I can see that. Can you see the muscles? Of course, I can see the muscles. This is anterior belly digastric and that is the posterior belly digastric. If this is anterior belly, posterior belly digastric, then I'll tell you this is the base of the mandible and this is the digastric triangle. Yes, it is. You have to understand, this is the base of the mandible, this is anterior belly of digastric, this is posterior belly of digastric, this is digastric triangle. What is at the floor of the digastric triangle? Floor of mouth. What is at the floor of mouth? The mylohyoid muscle. So you're telling that there is some mylohyoid muscle which is at the floor of the mouth and floor of the digastric triangle? Yes, a question came like that. So this is floor of the mouth. Floor of the mouth. Floor of the mouth? Yes, floor of the mouth. Okay. Mylohyoid, the muscle which come from mandible bone to hyoid bone? Yes, that is why it's mylohyoid. Coming from mandible bone to hyoid bone, mylohyoid muscle. I think it is a depressor of mandible. Yeah, it is depressor of mandible along with anterior belly of digastric. So anterior belly of digastric and the mylohyoid muscle are pulling the mandible down. Depressor of mandible. Open the mouth? Yes, open the mouth. They open the mouth. Okay. What else? Can you see this is the submental triangle? Submental triangle. Under the mentum of mandible? Yes, under the mentum of the mandible, submental triangle. What is it bounded by? What is the base? Base must be the hyoid bone. And what is the muscles? Anterior belly digastric on the right side, anterior belly digastric on the left side. So this is anterior belly digastric left side, right side, and this is the base is the hyoid bone. This is the submental triangle and the mentum of the mandible. Yes, that is where you have submental lymph node. If I have submental lymph node here, then I'll have submandibular lymph node here? Yeah, of course, some mandibular lymph node there, draining the lateral side of the tongue. Tip of the tongue will drain into submental lymph node, and lateral side of tongue will drain into the submandibular lymph node in the digastric triangle under the mandible, here under the mandible. Okay, which other triangle you want to see? If you want to talk about other triangles, you can see here. What? The thyroid gland. So this is the thyroid gland. Some glimpse of thyroid gland is here. Yeah, this is glimpse of thyroid gland because it is covered by some muscles, and they are, you know, here. What is this? What is this? This is the sternohyoid muscle. If you say this is the sternohyoid muscle, you are talking about the strap muscle here. Yes, the strap muscle. So this is sternum bone here. Yes, sternum bone. Sternum bone, and there's the hyoid bone. Yes, so sternohyoid muscle. Yes, and covering the thyroid gland. I cannot see the thyroid gland until I separate them. Yes, you have to separate them. So this is thyroid gland, which is in the anterior muscular triangle because some strap muscles are there. Yes, and where did I see the carotid artery? If you want to see carotid artery is not alone. Along with the carotid artery, you see there is common carotid artery bifurcating into two. So this is common carotid artery bifurcating into two branches. Yes. This is the common carotid artery which is bifurcating into two branches. Yes. And what is common carotid artery followed by? Common carotid artery is followed by internal jugular vein outside. Internal jugular vein outside. Yes, internal jugular vein outside. And common carotid artery inside. Yes. This is internal jugular vein outside and common carotid artery inside. Yes, where? This is all in the this is all in the carotid triangle. So this is all in the carotid triangle. Actually, there's a carotid sheath covering the vessels. So carotid sheath in the carotid triangle covering the internal jugular vein and common carotid artery. Yes, carotid sheath covering the internal jugular vein laterally and common carotid artery medially. Carotid triangle. Yes. What is it bounded by? Bounded by, don't you know? You remember there was this inferior belly of omohyoid? Yes. And then there was this superior belly of omohyoid. Yeah, okay. Superior belly of omohyoid. Fine. So that is what? This is inferior belly of omohyoid and that is superior belly of omohyoid. So this is the carotid triangle bounded by superior belly of omohyoid and the posterior belly of digastric and a muscle which you have, you know, removed from here. Which muscle you have removed? Sternomastoid. Sternomastoid. So you're telling that this is superior belly of omohyoid attaching to hyoid bone. Yes. This is inferior belly of omohyoid coming from scapula bone. Yes. And then this is the carotid triangle bounded by a muscle removed from here, sternomastoid. Yes. And then it is the superior belly of omohyoid and the posterior belly of digastric. Yes, that is the carotid triangle. Okay. What else you want to know? I want you to understand that there is third part of the subclavian artery. How do you know? Because second part is covered by this muscle. Who is this muscle? Scalenus anterior muscle. So this is scalenus anterior muscle? Yes. And what is behind that scalenus anterior muscle? The second part. If behind that is the second part, then where is the first part? First part is proximal to that. So you are now dividing the subclavian artery into three parts. Yes. How do you divide the subclavian artery into three parts? By a muscle called scalenus anterior muscle covering the artery. So when the scalenus anterior muscle covers the artery, what is proximal to the muscle? First part of subclavian artery deep to muscle, second part distal to muscle, third part. You can block the third part now. Where? In the posterior triangle. Where exactly? In the subclavian triangle. In the subclavian triangle. Yes. Can I see that on the other side of the diagram? Yes, it is here. So you are trying to block this part of the subclavian triangle? Subclavian artery? Yes, because this is first part of subclavian artery and this behind the muscle scalenus anterior is second part and this is the third part. I can block the third part. Where will you come? Press with your thumb. Take the thumb and compress the third part of subclavian artery on the first rib. It was running on the first rib. So where the thumb should go? Lateral to this muscle, scalenus anterior muscle. Your thumb should go lateral to this muscle, which is scalenus anterior muscle, and put your thumb here and block in this triangle. What is this triangle? What is this triangle? You know, middle of the clavicle and sternomastoid, which you have removed, and inferior belly of omohyoid. So inferior belly of omohyoid and the clavicle bone and the sternomastoid muscle here. Subclavian triangle, part of the posterior triangle? Yes, subclavian triangle, part of the posterior triangle. There you can block the brachial plexus also. Brachial plexus where? Lateral to this muscle. Lateral to which muscle? Scalenus anterior muscle. So scalenus anterior muscle is the boundary line landmark? Yes. Scalenus anterior is a muscle. Lateral to that you can block the third part of subclavian, and also you can block the brachial plexus. Why I am blocking brachial plexus here? Because there is a fracture, multiple fracture on the upper limb. But this diagram is not clear. Let us have a look on some clear diagrams. So we are going further now. As you go further, you'll find this question. It is asking, digastric triangle, what is wrong? And immediately you'll find the answer. It is asking, digastric triangle, what is wrong? Immediately you know the answer. Tell me what is the answer. You remember, if it was digastric triangle, then you will have anterior belly and posterior belly of digastric. So this is wrong, and that is the answer, because this statement is valid for which triangle? This statement is actually valid for what is bounded by the two anterior belly of the digastric? It is valid for the submental triangle. So on either side, if you say on either side you have anterior belly of digastric, then you are talking about the midline triangle, which is the submental triangle. Why? What about the digastric? Digastric, you know, there is anterior belly and posterior belly. Anterior belly, posterior belly. This is the digastric triangle. So anterior belly, posterior belly. This is the digastric triangle here, not here. No, this is submental. This is digastric. So choice number A is wrong. That is the answer. Yes. What about choice number B? Of course, you know, floor of the mouth is the floor of the submental triangle, mylohyoid. Not only mylohyoid, one more muscle, hyoglossus. Hyoglossus is also the floor. We did not see that. Yeah, you may have not seen, but this is the answer. Why? Because this is wrong. This is valid for submental triangle, and of course hyoglossus is there at the floor of digastric triangle. If you say hyoglossus is there at the floor of digastric triangle along with the mylohyoid, can I see them again? You mean to say two muscles at the floor of the digastric triangle? Yes. And is the mylohyoid nerve there? Why not? Mylohyoid muscle is there, nerve will be there. So mylohyoid muscle is there, supplied by mylohyoid neurovascular bundle. Of course, mylohyoid neurovascular bundle will supply mylohyoid muscle at the floor of the digastric triangle. No problem with choice number D. But I think there's a problem with choice number C. No, there is no problem. Problem was already there. So I'll keep my answer choice number A. Yes. What about choice number C? Choice number C, let us see the diagram. Then you will realize, but it is a correct statement. Problem is with choice number A. Keep the answer A. This is digastric triangle, which we are going to focus upon now. Not only digastric triangle focus, you have to focus upon carotid triangle also. But this time, you have to focus upon carotid triangle also. But this time, first you have to focus upon digastric. Then you can talk about the carotid triangle also. Actually, they are side by side. But first we have to discuss digastric. This is the diagram we have to discuss. Yes. What is in the diagram? Let us see what is in the diagram. This is the anterior belly of digastric. Where is anterior belly of digastric? It is here. And what is the origin insertion of anterior belly of digastric? Origin is the mandible bone and insertion hyoid bone. So origin is mandible bone, insertion hyoid bone, anterior belly of digastric. It is a depressor of the mandible to open the mouth. Yes. Okay, what about the posterior belly of digastric? If you're talking about the posterior belly of digastric, then you'll see it is attaching to hyoid bone and the mastoid bone. So it is attaching to hyoid bone and the mastoid bone, posterior belly of digastric. Yes. And this is the digastric triangle. If you say that is the digastric triangle bounded by the two digastric muscles, then what is the base? Base is this bone. What? The mandible bone? Yes. Now, when you say base is the mandible bone and antebelly, posterior belly, digastric, then what is the floor? Floor, you can see the two muscles now. What are the two muscles at the floor? Let us see what are the two muscles at the floor. But there are two muscles at the floor. So let us see the two muscles at the floor. Yes. And they are, see, one of them is called mylohyoid. Why mylohyoid? Because it is coming from the mandible bone to hyoid bone. So coming from mandible bone to the hyoid bone, yes, mylohyoid, and it is at the floor of the digastric triangle. If you say it is at the floor of the digastric triangle, I see there is one more muscle. Yes, you can see that also, and it is called the tongue hyoid. Tongue hyoid means hyoglosso. Okay, hyoglossous muscle, yes. Attaching to hyoid bone and tongue, yes. So attaching to hyoid bone and tongue, it is hyogloss. Glossus means tongue. Yes, glossus means tongue. It is a depressor of tongue. It can pull the tongue down. So pull the tongue down, depressor of tongue, the hyoglossous muscle. The tongue is pulled on, hyoid bone down. Yes. Is at the floor of digastric triangle. Yes, you know that digastric triangle is here. This is the digastric triangle. Now, if you say this is the digastric triangle, then it is at the floor of digastric triangle. Yes. Can you tell me this muscle, which is called as the hyoglossus, is supplied by? It's a tongue muscle, so it must be supplied by the 12th nerve. Yes, correct, 12th nerve. 12th nerve will come here now. See how it is coming. So, hyoglossus muscle is a depressor of the tongue. It's a tongue muscle, must be supplied by 12th nerve. Let us follow the 12th nerve here to supply the muscle. And when you're doing that, you will find this is the 12th nerve. 12th nerve came out through hypoglossal canal. 12th nerve is hypoglossal nerve, came out of hypoglossal canal and then come to enter this triangle. Which one? Carotid triangle. And after passing carotid triangle, go to the digastric triangle, supply the muscle of tongue, which is hyoglossus. You are following the course of 12th nerve. Yes. What is the course of 12th nerve? 12th nerve would have come from the hypoglossal canal, hypoglossal nerve, and in the carotid triangle and in the digastric triangle. How do you know this is digastric triangle and this is carotid triangle? This is carotid triangle because I see common carotid artery bifurcating into two branches. Oh, this is hypoglossal nerve in the carotid triangle because this is common carotid artery bifurcating into two branches. Yes, you can see common carotid artery bifurcating into two branches in the carotid triangle. Oh, that is where I have the, where is hypoglossal nerve doing after that? Going into this triangle, which is called digastric triangle. Why is it going to digastric triangle? Because it has to supply this muscle at the floor. Who is this muscle at the floor? Hyoglossus. You are telling 12th nerve is the content of the occipital triangle, content of the carotid triangle and then content of the digastric triangle. Yes, all of these are MCQs. Everything which I speak, each sentence is one MCQ. We don't speak beyond any MCQs. If it is not MCQ or expected MCQ, we will not speak at all. So this is MCQ. Yes, already. Okay, fine. So you're telling this is hypoglossal nerve in the carotid triangle. Yes. And you told that this is carotid triangle because you have some common carotid artery bifurcating into two branches, which is external and internal carotid artery. Yes. I think this common carotid artery is followed by some vein inside a sheath called carotid sheath. Yes, this is carotid sheath in the carotid triangle. So that is carotid sheath in the carotid triangle and enclosing the common carotid artery. Yeah, not only common carotid artery but also internal carotid artery, because external carotid artery will come out. So you're telling that inside the carotid sheath, first we have common carotid artery and later we have internal carotid artery, because the external carotid artery come out. Yes, external carotid artery will come out, give 8 branches in the neck, but Internal carotid artery, which is a continuation of common carotid artery, will be inside the carotid sheath along with the vein. Which vein? That is the vein you have seen. Which one? Internal jugular vein, more lateral. So artery is more medial, yes, and vein is more lateral, yes. Internal jugular vein is a content of carotid sheath. Between the two vessels, there is a nerve behind the two. Between the two and behind the two. So between the two, behind the two, you have a nerve, means you are talking about the vagus nerve here. Yes. Are you telling vagus nerve is a content of carotid triangle? Of course. Vagus nerve is a content of the carotid triangle inside the carotid sheath. So it is also inside the carotid sheath. Yes, actually. There is a common carotid, internal carotid artery, and internal jugular vein, and vagus nerve. Between the two and behind the two, it is posterior to the vessels, but inside the carotid sheath. Now, once you say this neurovascular bundle is inside the carotid sheath in the carotid triangle, understand there is something embedded anteriorly. What is that? Ansa cervicalis. So, ansa cervicalis is embedded anteriorly, supplying what? Muscles, anterior neck muscles. Can you give some example? Of course. You remember there was a sternohyoid muscle coming from sternum bone to hyoid bone. It is supplied by ansa cervicalis. You know, from the scapular bone to hyoid bone, omohyoid muscle. Omohyoid muscle also. Yes. So omohyoid muscle and sternohyoid muscle, anterior neck muscle, are supplied by ansa cervicalis, which is embedded to the anterior wall of the carotid sheath. Yes. And what is behind the carotid sheath? Behind the carotid sheath you want to see. Yes. Then you remove it and see behind. And when you remove it, see behind, there is a sympathetic chain. You can block it there. What I block? See, take your hand here and push the carotid sheath to one side to see the sympathetic chain and block it. What? Stellate ganglion block? Yes, stellate ganglion block. Why would I block the stellate ganglion? Because there is a female with Raynaud phenomena. Gangrene is pending. And what else? Hyperhidrosis. What are you doing? I am separating the carotid sheath to one side. Why? Because behind that is sympathetic chain. I want to block stellate ganglion. Why? Because when I block it, I'll block the sympathetic vasoconstriction and sweating. So there was some sympathetic vasoconstriction leading to gangrene, impending gangrene, Raynaud phenomena. Or this person was having hyperhidrosis because of overactivity of sympathetic system. Yes, so you will remove it. Yes, hyperhidrosis or Raynaud phenomena. Okay, fine. Can I see some diagrams for that? Of course you will. But this is the relation. Now, you are talking about digastric and carotid triangles. Yes. Can we draw them now? Yes, you have to draw them. Where? Actually, this is the front view of the neck region. Yes, that we can see. This front view of the neck region, you will magnify further. Why will I magnify it further? To see the details of the two triangles. Which triangle? You remember there was this hyoid bone here. Yeah, hyoid bone. You remember there was this mandible bone here. Yeah, mandible bone. You remember there was sternum bone? Yes, sternum. I also know there's a clavicle. I also know there is a scapular bone. Now what? You remember there was a muscle coming from scapular bone? Scapular bone, I know. It is coming from scapular bone and it will come here and it will go there. This is called omohyoid. Yes, omohyoid. Right, this is omohyoid. Now this is omohyoid, you are telling. Fine. You know, there's a sternomastoid. Of course, I know sternomastoid. I'll tell you, this is sternomastoid. Sternum, clavicle, and sternomastoid. Going to the mastoid process, there's sternomastoid. Okay, can you show it on the other side? Of course, I can show on the other side. This is sternomastoid. On the other side. Then can you show me the digastric muscle? Digastric, I'll show. This is the anterior belly of digastric and that is the posterior belly of digastric. Okay, can you show it on the left side? Left, of course. This is anterior belly of digastric and this is the posterior belly of digastric. Okay, now you have shown it. Fine. Can you tell me the content of the carotid triangle, digastric triangle? Content of carotid triangle, digastric triangle. Yeah, a nerve. Which nerve? Actually, there was a nerve which came here. Yes, where? It was both places. Both places. Are you talking about 12th nerve here? Yes, hypoglossal nerve, supplying hypoglossus muscle. So this is the 12th nerve, which is a content of the carotid triangle, then the content of the digastric triangle to supply a muscle which is at the floor of the digastric triangle. The muscle is called as the hyoglossus muscle. Yes, hyoglossus muscle. Hyoglossus muscle. Who else was there at the floor? At the floor we had one more muscle. Who was that? That was the mylohyoid. So mylohyoid muscle is at the floor. Yes, floor of the mouth. Yeah, floor of the mouth, but also floor of the digastric triangle. Also the floor of the submental triangle. Oh, also the floor of the submental triangle? Yes. Then you will tell this is the hyoglossus muscle on the other side? Yes. Then you will tell this is the 12th nerve on the other side? Of course. Of course, 12th nerve on the other side. So you are telling me about digastric triangle now, bounded by, digastric triangle is bounded by, base is the mandible bone and anterior belly, posterior belly, digastric, and there is a mylohyoid muscle at the floor with the hyoglossus, and hyoglossus supplied by the 12th nerve, which is first a content of the carotid triangle, then a content of the digastric triangle. There is submandibular lymph node also, then there is submental lymph node in the submental triangle here. Which muscle is at the floor? Mylohyoid muscle. So mylohyoid muscle is at the floor of the submental triangle also. Yes. And which lymph node are you talking about? Submental lymph node, tip of the tongue. So tip of the tongue draining into submental lymph node, and it is only one in the midline. Yes, only one in the midline, and having a floor of mylohyoid muscle there. Okay, what do you see in the carotid triangle? Carotid triangle you want to know. Yes. Okay. I'll magnify and show. What will you show? See, this is the common carotid artery bifurcating into two branches. Common carotid artery bifurcating into two branches. Yes. And what else was there? There was this internal jugular vein. What is that? Internal jugular vein. So that is the internal jugular vein. Yes. You are telling that there is some internal jugular vein, and what is medial? Medial is the common carotid artery continuing as internal carotid artery. So common carotid artery continuing as internal carotid artery. Yes. So this is common carotid artery continuing as internal carotid artery, and external carotid artery will come out of that sheath you are talking about. Yes, carotid sheath, carotid sheath. This is the carotid sheath. If that is the carotid sheath, what is inside the carotid sheath? It is the common carotid artery and the internal carotid artery. And what else? This internal jugular vein coming down. Internal jugular vein coming down, artery going up. Of course, artery go away from the heart and vein come towards the heart. And what is sandwiched between the two? Vagus nerve. Between the two and behind the two. So between the two and behind the two. Yes. Between the two and behind the two, this is the vagus nerve. Yes, that is the vagus nerve. So between the two and behind the two, this is vagus nerve. Yes. Inside the carotid sheath in the carotid triangle. Yes. Inside the carotid sheath in the carotid triangle. What is embedded anteriorly? What is embedded post? No, not embedded. Embedded is only anterior. Yeah, what is embedded anteriorly? What is embedded anteriorly is this. What is this? First you show the carotid sheath, and then you tell what is embedded anteriorly. What is embedded anteriorly is this ansa cervicalis. And what is ansa cervicalis doing? Embedded anterior to carotid sheath. It is supplying this muscle. Which one? This one. Who is this? This is the omohyoid. So omohyoid muscle is being supplied by the ansa cervicalis embedded on the anterior wall of the carotid sheath. I think it was supplying some other muscle which was running down here to the sternum. Yes, that muscle running down to sternum, which is called as the sternohyoid on each side. And sternohyoid on each side was covering this thyroid gland in the midline. So it was covering this thyroid gland in the midline, the anterior muscular triangle. Yes, there is thyroid gland in the anterior muscular triangle covered by sternohyoid, and sternohyoid is supplied by ansa cervicalis, which is also supplying omohyoid muscle. What is behind the carotid sheath? Behind the carotid sheath is this nerve trunk. Which nerve trunk? The sympathetic trunk. So there you have the sympathetic trunk. Yes. Stellate ganglion there. Yes. I can block the stellate ganglion now. Yes. But you have to move the sheath. So we have to move the sheath on the left side. Yes, left side, right side, whatever side you want. So we have to move the carotid sheath now, and then behind that is some sympathetic chain, and that is what we can block if it is a case of hyperhidrosis and Raynaud phenomena. Yes, hyperhidrosis, Raynaud phenomena. Okay, fine. What is next? Next, let us see what is next. Actually, you are doing the block. Stellate block. Yes. Okay. How do I do it? I just told you. What? Move the carotid sheath and do ultrasound and mark the trunk and block it. You mean to say stellate ganglion block? Yes. Why I am blocking? Impending gangrene. That is why. Raynaud phenomena. What is Raynaud phenomena? Raynaud phenomena is sympathetic overactivity. Sympathetic overactivity. That is why you are trying to kill the sympathetic system. Yes. It was sympathetic vasoconstriction leading to ischemia, impending gangrene. So Raynaud phenomena is sympathetic overactivity. Yes. Vasoconstriction is more. Yes. Ischemia and gangrene impending. Yes. So you don't want that. No. What about hyperhidrosis? You know, sweat gland is under which system? That's why. Oh, sympathetic overactivity, more sweating. Yes. And I kill the sympathetic system to kill the sweating. Yes, you can do that. These are the two indications. How do I do it? How do you do it? I told you. How do you do it? Take ultrasound, probe, and find and mark the stellate ganglion behind carotid sheath and inject the agent, whichever agent you want to use, inject the agent and block the, who is this lady? This lady was having Raynaud phenomena. Peripheries are having ischemia, pallor, and that is not red fingers. If fingers are not red, then what are they? They are yellow, pale, and after some time black. You want black fingers? No. So red fingers have become pale and they are going to become black. Don't let them become black. Kill the sympathetic overactivity, stellate ganglion block. Okay, fine. I'll do it here. Fine. In the carotid triangle, of course, in the carotid triangle, behind the carotid sheath. Right. In front of sternomastoid, of course, in front of sternomastoid muscle. Okay, in front of sternomastoid. Anterior triangle? Yes, anterior triangle. Now you tell me what are the contents of carotid triangle? Revision. So it is a revision of the content of the carotid triangle. Let us look at that. Let us magnify that. Anterior to sternomastoid? Of course, anterior to sternomastoid. Why are you asking this again and again? Anterior to sternomastoid. Of course, it is anterior to sternomastoid. Okay, what are the contents? Carotid sheath enclosing. It is carotid sheath enclosing common carotid artery plus continuation internal carotid artery. Along with that, laterally interjugular vein and the vagus nerve is between the two, behind the two. They are all inside the carotid sheath in the carotid triangle. What else was embedded anteriorly? Ansa cervicalis. What was behind there? Sympathetic trunk. What were you blocking? Stellate ganglion in the carotid triangle. What else was there? Actually, 12th nerve was there, but it was then going into digastric triangle. So 12th nerve was first in the carotid triangle, then going to digastric triangle. Yes, to supply hyoglossus muscle there. So 12th nerve was in carotid triangle, going to digastric triangle, supplying hyoglossus muscle, tongue muscle. Yes, and you block the stellate ganglion here. Yes, behind the carotid sheath. And what is embedded anteriorly? Ansa cervicalis. And what is inside the carotid sheath? Artery, vein, and nerve. Can I discuss what is in the posterior triangle, occipital triangle? If you want to discuss what is in the posterior triangle, occipital triangle, let us magnify and see. Actually, you can do 3 blocks there. Which 3 blocks can be done? You know the 2 blocks already. Which 2 blocks we already know? You remember I told you, you can block the brachial plexus here. Why? Multiple fractures upper limb. So multiple fracture upper limb, you will block the brachial plexus in the neck region, posterior triangle. Okay, the subclavian triangle lateral to a muscle which is called as the scalenus anterior muscle. Yes, that is what. So brachial plexus you can block. I think you blocked some part of the artery also. But it is not exactly occipital triangle. It is not exactly occipital triangle. It is actually posterior triangle, but which part? This can be blocked not exactly in the occipital triangle. See, maybe they are content of occipital triangle, but you block them where? Brachial plexus block and subclavian artery third part block. Maybe they are in occipital triangle, but block is done where? Subclavian artery third part is blocked and brachial plexus blocked in the smaller part of the triangle, posterior triangle, which is subclavian triangle. So can we see the boundaries of subclavian triangle and block now? Yes, we'll do that, of course. But remember, third part of subclavian artery or maybe brachial plexus is actually blocked in the subclavian triangle, part of the posterior triangle. And what else is blocked here? Cervical plexus. And why would you block the cervical plexus? I will block the cervical plexus because I'm operating here. Where are you operating? You remember cervical plexus, posterior border of the sternomastoid, in the midpoint of sternomastoids, giving greater auricular nerve, giving lesser occipital nerve, giving the transverse cervical nerve, giving the supraclavicular nerve. That is what I want to block. Can we see some diagram for that? Yeah, but your point is, here, midpoint of sternomastoid, some nerves were given. Greater auricular nerve and the lesser occipital nerve and the transverse nerve of neck and the supraclavicular nerve. That can be blocked. Cervical plexus can be blocked here. Where? In the occipital triangle. Yes, occipital triangle. What else is there? You know, there is a nerve coming, supplying the two muscles. What is this nerve coming, supplying the two muscles? You remember there is spinal accessory nerve supplying sternomastoid and then it is supplying the trapezius muscle. So if the spinal accessory nerve, if you are telling spinal accessory nerve is coming here, it is coming from the sternomastoid and then supplying the trapezius, what will happen if I have a lesion? Because it is running very superficial here. I was draining some abscess in the posterior triangle. So remember, when we were draining some abscess in the posterior triangle, be careful to surface mark the nerve. Otherwise, you will damage the nerve. And when you damage the nerve, one muscle will be paralyzed. Which one? You're draining an abscess in the posterior triangle, incision and drainage. In the incision and drainage, when you drain that abscess, you have damaged the nerve because you did not bother to mark the nerve and you have damaged it. It is iatrogenic injury. So if you are telling that it is iatrogenic injury by some physician, surgeon, which muscle will be paralyzed? Of course, trapezius, and difficulty shrugging the shoulder. But why the trapezius is paralyzed and why not the sternomastoid? Because understand, wherever the nerve is injured, only distal area is involved, not the proximal area. Wherever the nerve is injured, only distal area is involved, not the proximal area. Why? Because it has already supplied sternomastoid, then you have damaged it. After that, it was going to supply trapezius. So it has already supplied sternomastoid, yes. And then it was going to supply the trapezius, yes. And then it was damaged, so there will be the next muscle paralyzed trapezius, not the sternomastoid. No, sternomastoid still working. What is not working is trapezius. That's why difficulty shrugging the shoulder. Everything is a MCQ, you know. Who else is there in the posterior triangle? We have told subclavian third part, which can be blocked in the lower subclavian triangle. An external jugular vein is there. And cervical plexus can be blocked here. Brachial plexus can be blocked here. Phrenic nerve. You know, phrenic nerve is also coming from here. Where? Cervical plexus. Yes. So I'll block it. You will block phrenic nerve. Why would you do that? You cannot block the phrenic nerve, because if you block the phrenic nerve coming from cervical plexus, then there will be diaphragm paralysis, difficulty breathing. You want difficulty breathing in the patient? Don't do that. You can block the cervical plexus other branches, greater auricular nerve, lesser occipital nerve, maybe transcervical nerve of neck, maybe supraclavicular, this is the clavicle bone, supraclavicular nerve, but not the phrenic nerve. You are not supposed to block phrenic nerve. So phrenic nerve is the content of the posterior triangle. Of course it is, coming from cervical plexus there. Can we see some other diagrams now? Yes, you have to, because you are doing the subclavian artery block now. So subclavian artery block, third part? Yes, third part. I think it is running on the superior surface of first rib. Yes, it is running on the superior surface of first rib. Take your thumb, lateral to this muscle. Lateral to which muscle? Scalenus anterior muscle, and block the third part of subclavian artery. Do this. What are we doing? Take your thumb lateral to this muscle. Which one? Sternomastoid. Of course sternomastoid, but lateral to one more muscle. Which one? Of course your thumb will go lateral to the sternomastoid. This is sternomastoid. This is the sternomastoid muscle. Now this is the sternomastoid muscle, fine. Then there will be one more muscle here. I can't see any more muscle here. You can't see? No. Okay, you will see later, but this is where you do. So lateral to sternomastoid and lateral to scalenus anterior muscle. Yes. Using the thumb, I will block one artery which is under the clavicle. Yes, artery which is under the clavicle, but superior surface of the first rib. Compress it on the first rib. Subclavian artery. Subclavian is, of course, subclavian under the clavicle, but over the first rib. Compress it. What is it going to become in the axilla? What is going to become in the axilla is axillary artery, of course. Axillary artery in the axilla. So that was subclavian artery in the neck region. Yes, subclavian artery in the neck region. Okay, let us do it. Do what? The blocks. You told blocks, we will do blocks. You want to do the blocks? Yes. Okay, then you have to magnify this diagram. This is the lip of the man, nose of the man, ear of the man. So just for orientation, and you want to look at the right side of the neck region. Yes, there I want to do the two blocks. I'll magnify now. You're magnifying this posterior triangle of the neck. Yes. Okay, magnify and discuss the block. As you will realize that this was the muscle which is called sternomastoid muscle. Yes, sternomastoid. Okay. Then you will realize that there was a muscle which is coming from scapula like this to the hyoid bone. You mean to say omohyoid? Yes. You know the muscle of the upper back? Muscle of upper back, yeah, okay. You are talking about trapezius. Trapezius. Yeah, trapezius. This is trapezius. This is sternocleidomastoid. This is inferior belly omohyoid. You mean to say this is clavicle bone now? Yes, of course, that is clavicle bone here. You mean to say this is the occipital triangle? Yes. And this is the subclavian triangle? Yes. That is where you will block the brachial plexus. Not only brachial plexus, I'll block the third part of subclavian artery also. Okay, then do it. But before I do that, I'll just tell you, I can block this also. What are you blocking? You remember there was midpoint of sternomastoid posterior border. So midpoint of sternomastoid posterior border, there you were having some cervical plexus. You can block it here. Branches like greater auricular nerve, lesser occipital nerve, transverse cervical nerve of neck, and the other one which was coming down. Supraclavicle? Yes, supraclavicular, that you can block. Where? In the occipital triangle. Where? On the midpoint of sternomastoid. Where? On the posterior border of sternomastoid. But I don't want to block cervical plexus. I want to block the brachial plexus. Show me the brachial plexus. If you want to see the brachial plexus, magnify further. Further? Yes. Why? Because now you have to talk about the first rib. First rib? Yes. What about the first rib? Actually, you know, there is a scalenus anterior muscle which is coming to insert on the first rib. So this is scalenus anterior which is coming to insert on the first rib. This is the first rib here? Yes, that is the first rib. So you are telling this is the first rib here. Yes, that is the first rib. And on that is this muscle attaching, scalenus anterior. I think on the first rib the other muscle is also attaching. Yeah, correct, you are. It is scalenus medius. So this is scalenus medius. Yes. Attaching to superior surface of the first rib, and then I know, yes, I know. It is attaching to superior surface of the first rib, and this is some carotid tubercle. You were telling some carotid tubercle where the scalenus anterior muscle will insert. Yes, that is scalenus anterior muscle which is inserting to carotid tubercle on the inner border of the first rib. And this is scalenus medius which is inserting superior surface of the first rib. And what is between the two? Between the two is interscalene triangle. Interscalene triangle, and that interscalene triangle, that is where you do both the blocks. So this is the interscalene triangle where I will do both the block. Which block? You know the artery. Which artery? This internal carotid artery, this subclavian artery. Subclavian artery is going to cross the first rib to enter axilla, become axillary artery. So as it is crossing the outer border of the first rib, it'll enter the axilla, become axillary artery. But before that, it was in the neck region, so it is called as subclavian artery. It has first part behind the muscle, before the muscle, second part deep to the muscle, and third part distal to the muscle. Which muscle? Scalenus anterior. If we say this is the scalenus anterior muscle, then proximal to that, first part, deep to that, second part, distal to that, third part. And I want to block the third part. If you want to block the third part, take your thumb lateral to this muscle. You go lateral to this muscle, take a thumb and compress the artery on the superior surface of the first rib. So you have to compress this third part of the subclavian artery on the superior surface of first rib. You can also block some brachial plexus here. Remember that brachial plexus come here. These are the trunks of brachial plexus. So trunks of brachial plexus are in the neck region. Yes. And where are the cords? Cords are in the axilla. So cords of brachial plexus in the axilla. Yes. And trunks are in the neck region. Yes. We are blocking the trunk region now. Yes, you block it. Let us do it. You are doing it right now? Yes, we are doing it right now. Right now means right now. Yes. What is this? This is the diagram which the examiner is giving you. In the exam, you have a computer given, computer-based test. This is the dissected specimen identified. As if yesterday the examiner was there with you in the dissection hall and showing you, demonstrating this is this, this is this. And today you have come to the exam hall. Tell what is the answer. Yesterday I told you, today you don't know the answer. That kind of questions come. They have forgotten that we have forgotten this long back. 5 years back I was in the dissection hall and I was never on my table. I was on some other table. By the end of the class, I'll come back to my table and only 2 people keep dissecting throughout the year. I'll ask them what you have dissected and they are telling, we have dissected everything. Nothing is left now. That is the story of our first year MBBS. But anyway, we have to manage now somehow. What is this? This is the brachial plexus which you were blocking. Where? In the neck region. Why? Multiple fractures upper limb. Oh, right. Brachial plexus in the neck region. The trunks of brachial plexus in the neck region. Yes. Okay. What is this part of the subclavian artery in the neck region? That part of subclavian artery in the neck region is third part of subclavian artery, which you can block taking your thumb. Compress the artery on the superior surface of the first rib. Remember? But your thumb should go lateral to one muscle. You know, this is interscalene triangle. In the posterior triangle. This is interscalene triangle in the posterior triangle. I think there are 2 muscles here involved. Yes, name them. I think this one is the scalenus anterior muscle inserting on the first rib. Scalene tubercle. Yes. And that is the scalenus medius which is inserting on the superior surface of the first rib. Yes. And bounded by the 2 is the scalene triangle where I have this brachial plexus. Yes, brachial plexus is the interscalene triangle bounded by scalenus anteriorly and medius posteriorly. If you want to block the brachial plexus, you need to go lateral to this muscle, which is called as scalenus anterior muscle. And when you go lateral to this muscle, you can block the brachial plexus. Not only you can block the brachial plexus, but you can also block the third part of subclavian artery. What are we doing now? Supraclavicular block of the brachial plexus. Take a probe, and once you have taken the ultrasound probe, then you inject the anesthesia agent there. This is how you do it. Above the clavicle, yeah, supraclavicle. In the posterior triangle, yes, posterior triangle. Like that, yes, like that. Okay. What is this happening here? You see, there's a magnified picture. Magnified picture of what? The first rib. And what is inserted on that? The scalenus anterior and medius. What is between the two? Interscalene triangle. What is in the interscalene triangle? This is actually axillary sheath covering the brachial plexus and axillary artery. But this is not axillary artery, this was subclavian. Yeah, it is subclavian, but crossing the first rib, it will become axillary artery. You are telling that after crossing first rib, the subclavian artery would have become axillary artery? Yes. And this is some brachial plexus in the axilla? Yes. And covered by some axillary sheath? Yes. Where is axillary vein? Axillary vein is outside axillary sheath. Only axillary artery and brachial plexus is inside the axillary sheath. Axillary vein is outside axillary sheath. One of the JIPMER question, and this is Morgan's anesthesia book. This is Morgan's anesthesia book. This is Morgan's anesthesia. You are reading that book now. Yeah, I told you I read 400 books. Sir, you are joking. I don't joke. You don't? No. Why you don't joke? Why you are so serious? Because this is a serious job. What you are doing is serious job. You have to get a PG seat. Be serious. You cannot joke about that. I cannot joke about that. This is a serious business. Oh, this is a serious business. Okay. But I am not an anesthetist. Yeah, maybe you are not an anesthetist, but they want you to become an anesthetist before you get a PG seat into anesthesia. Do you know? MCH questions are asked to you. So this is some scalenus anterior muscle inserting on the first rib. This is scalenus medius inserting on the first rib, and sandwich between the two is the brachial plexus and the subclavian artery, which will later become axillary artery, and we can block this artery on compressing on the first rib, and we can also block the brachial plexus. That is a point? Yes, that is a point. This is called interscalene triangle. That is the interscalene triangle. Okay. What is this? This is the vein. What vein? Subclavian vein, and later become axillary vein here. Actually, in fact, it is axillary vein which will become the subclavian vein, because it is going toward the heart. Artery is coming, vein is going. Artery is coming means subclavian artery becoming axillary artery now. Yes. And subclavian vein will become axillary vein will become subclavian vein then. Yes. At the outer border of first rib. Yes. I think these artery vein are sandwiching some muscle. Yes. You have known earlier also. The subclavian artery vein sandwich the scalenus anterior muscle here. And see, the sheath do not enclose the axillary vein. Axillary sheath do not enclose the axillary vein. Axillary vein is outside the axillary sheath. Then what is inside? Only brachial plexus and the axillary artery in the axilla. All of these are MCQs. Each line, each sentence is one MCQ. This is the subclavian artery now. Yes, third part. You can block it. And it is entering. This is where we were blocking it. Yes, that is where you are blocking. But we have seen all that. We are telling that it is now entering the axilla to become axillary artery. So after crossing the outer border of first rib, yes, after crossing the outer border of first rib, it would have entered the axilla to become axillary artery. So this is now axillary artery, and that is the subclavian artery in the neck region. Neck region, subclavian, and axillary artery in the axilla. Fine. I think this is the axillary vein outside the axillary sheath, crossing the outer border of the first rib to enter the neck region and become the subclavian vein in the neck region. Yes, that is what we have discussed just now. Okay, what is brachial plexus doing? Brachial plexus was in the neck region, now passing behind the clavicle bone, which we have cut here. So you have cut the clavicle bone here, yes. So brachial plexus was in the neck region and it is passing behind the clavicle bone to enter the axilla region, and which is covered by a fascia. With fascia, actually there is a fascia at the floor of the posterior triangle. What is this fascia at the floor of the posterior triangle? It is called prevertebral fascia because it is in front of vertebra. So in front of vertebra you have prevertebral fascia, and it is at the floor of the posterior triangle, covering muscles there. Yes, muscles like, you know, scalenus medius. So it is covering the scalenus medius now. Yes. This is prevertebral fascia in front of the vertebra and in front of the muscles also. Yes. And on the floor of the posterior triangle. Yes. And what is it doing? It is extending into the axilla as the axillary sheath. Why? Because brachial plexus will pull it into the axilla. And what else is the content? The axillary artery. You are telling axillary sheath is a continuation of the prevertebral fascia into the axilla? Yes. Axillary sheath is a continuation of the prevertebral fascia into the axilla, and the content are the brachial plexus and the axillary artery. Brachial plexus and the axillary artery. The axillary vein is outside the axillary sheath in the axilla. One of the Jepner question. Okay. What is this? This is the midpoint of the sternomastoid posterior border. So this is the posterior border of the sternomastoid midpoint. I think that is where was given the cervical plexus. Yes, you see these branches are cervical plexus. You can block the cervical plexus in the occipital triangle, part of the posterior triangle. And this is the branch phrenic nerve. How do you identify phrenic nerve? Phrenic nerve is identified by the fact that it is a branch of the cervical plexus. Yeah, fine, but where is it coming? Posterior border of sternomastoid. And where is it going? To the anterior surface of sternomastoid. Phrenic nerve is identified by the fact that it is coming from the cervical plexus and running on the anterior surface of scalenus anterior muscle. It is running on the anterior surface of scalenus anterior muscle. And where is it going? To the diaphragm and supply the diaphragm, motor supply. It also carries sensation from central portion of the diaphragm. It also carries sensation of the mediastinal pleura, pericardium, peritoneum. So phrenic nerve is carrying sensation from central diaphragm, central pleura, central pericardium, central peritoneum. Yeah, mediastinal, because it is running on the mediastinum. Downward towards the diaphragm to supply diaphragm. Is a question. They give you the diagram, dissected specimen. On that they show the nerve and you have to identify A, B, C, D. That's why it's important to identify. Okay, we are blocking the cervical plexus now. Where you already know it is actually the muscle. What muscle? Sternomastoid. Oh, behind the sternomastoid? Yes. And why I'm blocking it? You're blocking it because maybe you're working on the auricle, or maybe you're working behind the auricle, maybe you are working in the neck region, maybe you're working on the supraclavicle region. So you're manipulating the needle in directions. Yes, you manipulate the needle, but you are at the posterior border of the sternomastoid and midpoint of sternomastoid, and there you can manipulate greater auricular nerve, lesser occipital nerve, transversocervical nerve of neck, or maybe the supraclavicular nerve, but not the phrenic nerve. Don't block the phrenic nerve. Okay. Can you tell me the content of the posterior triangle? That we already know. Yeah, but can you revise them? Yeah, okay, let us revise them. You have blocked three things there. What three things we have blocked? Actually, you are blocking the third part of subclavian artery, but not in the occipital, in the lower part, which is subclavian triangle, in the interscalene triangle. And what was the cervical plexus blocked in? It was in the occipital triangle. And where was the trunks of the brachial plexus blocked? That was in the subclavian triangle, part of the posterior triangle. And where the blocked the phrenic nerve? You did not block any phrenic nerve. Don't block phrenic nerve. Okay, where was the phrenic nerve running? On the scalenus anterior muscle anteriorly. So it is identified with the fact that it runs the scalenus anterior muscle anteriorly. And what about the 11th nerve? 11th nerve, you know. This is 11th nerve. You are telling that this is the spinal accessory nerve which is coming from sternomastoid to supply the trapezius, and it was damaged by iatrogenic injury and paralysis of the trapezius. That is the thing. Yes, remember, spinal accessory nerve is a superficial content of the posterior triangle, can be iatrogenically damaged. Now we got a question on that. Let us see the question. So you want to see the question now? Yes, we want to see the question. Okay, where is the question? This is the question. What is it asking? There is a superficial cut. The nerve run very superficial. Where you have cut? In the middle. This is iatrogenic injury of the posterior triangle. Now tell me what is the problem. Actually, this question has double answer. If the question has double answer, then which one is mine? You tell me which one is your. So official cut, you have damaged iatrogenically the spinal accessory nerve, trapezius is gone. And when trapezius is gone, what is the problem? Problem, I told you. Now, you will think that this is the answer. Yes, it is the answer. But do you know, this muscle is also important for overhead abduction along with serratus anterior. So, trapezius and overhead abduction. To comb my hair. To comb the hair, you need two muscles. Yes, one is the trapezius, one is the serratus anterior. So, double answer. Yeah, because this will be compromised. So, double answer. Which one should I take? I think C is better than D. Why C is better than D? Because for this I need another muscle also, which is serratus anterior plus trapezius. So this is serratus anterior plus trapezius. That is why C is a better answer. Yeah, maybe C is a better answer than D. But both are answers in fact.